We're sisters.
We're sisters. We're sisters, if you couldn't tell. Doctor, engineer, stereotypes. Why did you choose the doctor profession? Were you forced into it? What's going on?
The most common place to get toenail fungus, drum roll, the nail salon.
Are Manolos worth it? What type of heels are you looking at? Do you recommend?
My daughter does not wear Crocs. I don't own a pair of Crocs. I feel like Crocs
Your mother does.
Testing 1, 2, 3. You're tuned in to Up and Coming, the pod where we discuss everything that is up and coming with your girl, Aman Fatima.
All right, hey guys. So it's the DC edition again, okay? And this is episode 2, and we have a super special guest. I don't know if you're going to be able to recognize who's who, because apparently everyone says we're twins. Do you think we look like twins?
I think there are certain angles that we do. All my friends always say, is that you or is that Gideon?
Literally at your wedding, people were like, why is the bride going around? I'm like, I'm not the bride.
Well, we're sisters.
We're sisters, if you couldn't tell. All right, Dr. Aman Fatima Malik, welcome to Up and Coming.
Thanks for having me. I feel super privileged, especially since, just super privileged.
I'm super excited to have you here. So before we address what we're here to talk about, I think the elephant in the room is you're my sister, older. Just want to put that out there.
Thanks.
Doctor, engineer, stereotypes. Why did you choose the doctor profession? Were you forced into it? What's going on?
So just to clarify, I love being a doctor, but I remember growing up, it was always like, you have these 3 options: doctor, engineer, lawyer, pick one. So I gravitated towards medicine. You remember when, during the summers we'd go to the village.
Yeah.
And in Pakistan, and I was going up a ladder. When I came down, I fell and I broke my arm. After I broke my arm, I was rushed to the hospital, and they were like, oh, you fractured your arm, so here's a cast. But the doctor that walked in was a female doctor, and she treated me. And since then I was like, I love the fact that I looked up to her. She healed me. The summer was great after 6 weeks of being in a cast and, basically throwing a tantrum every day for not getting water inside my cast. But anyways, that really showed me that I wanted to do something that made a difference.
Do you even remember pre-6? Did you even have that thought? Or was it like the moment you saw the doctor, that's when you were like, oh, okay?
I always wanted to help people. Me. It was whether it's showing them the right direction to go somewhere, anything. I always wanted to be helpful. I was helpful, taking care of you and our other sister, Zaheen.
Oh my God, this is good. Shout out to Zaheen.
Golden child.
Middle child. Elder child. So I think we can see the elder child energy. And then there's always... honestly, justice for the younger children. Everyone says that we live the most privileged lives, and I don't think we do.
I feel like you turned out all right for being the most spoiled youngest child of the family. So good job.
But thank you, Golden Child, for coming on the show. Okay, so now you know what? Okay, we got the doctor, Golden Child. You saw a female doctor in the villages, not of Piedmont, but of Pakistan, because we're in the village of Piedmont.
Gotcha.
Okay, so now that we know that you're a doctor, there's a million types of doctors. Okay, so just to clarify, you are a podiatrist, not a pediatrician, which a lot of people have been asking me. And I'm apologetic because I don't feel like I know too much about medicine, but the only time I've heard about podiatry, the meme.
Seinfeld, where he's like, you're not a doctor, you're a podiatrist.
Which is just... I hate that.
Well, you hate that.
That really pisses me off. That actually really pisses me off because I've seen you work your ass off. No jokes. Everything aside, you worked harder than all of us. I saw how long and how just everything that took for you to get here right now.
Yeah.
So even that just really meme, seeing people just reference that joke whenever I tell them, that really, really annoys me. So you know what? This is a moment, justice for podiatry, not pediatrician. What is it? What is it?
So podiatrist is a specialist in foot and ankle conditions. It can range from anything. The simple stuff we all know. We can talk about it further today. In the U.S., podiatrists actually are surgeons. I do a lot of 3 days out of the week. I'm in the OR taking care of a lot of foot and ankle deformity. So to Seinfeld, but we're doing a lot to change how we're viewed in society, but also we're very valuable members if you want to save your feet.
Yeah.
Feet are a big investment, believe it or not.
They're literally what we walk on.
Exactly.
What do we need to know about feet? You know, as someone just doesn't know, what do I need to know?
So a lot of stuff, but let me tell you the most common condition. So as a clinician practicing in the Northern Virginia area, the most common, I would say 1 out of 10 Americans suffer from heel pain, plantar fasciitis.
Okay.
So,
I've heard of that.
Yeah, I have pain in my heel. What can I do? How do I get it better? The crazy part is 90% of patients with heel pain can heal without any sort of surgery, injections, whatnot, just from stretching or modifying shoe wear. That's an amazing statistic.
Interesting. So are the people, you say heels, so I'm thinking heels, whatever, like, you know, women. Is it because we're always wearing heels, or who's coming for heel pain?
Anybody can. Females are affected because of heels. Yeah. So if you're wearing, you know, a lot of heels, or if you're a little bit overweight and you're putting a lot of pressure on your heels, you can develop heel pain as well. But it's mostly, a lot of females do unfortunately suffer from it, but runners can suffer from it. Anyone can suffer from it.
So are we just not supposed to be wearing heels? Are we not supposed to be wearing any type of shoes? Like, what's going on?
So good question. This has been a passion of mine, right? Because we all want to wear cute shoes. Yeah. But you're like, so what height can I wear where I won't be limping at the end of the night?
Or what type of height? Is it like the stiletto? Is it like I don't even know what the other one's called.
Yeah, so the optimum heel height is 2.5 inches. If you go above 2.5, you will off balance yourself from center of gravity, right? So you'll start putting more weight on the outside of your feet. If you want to stay more balanced, avoid back pain even, 2.5 and below will keep you in that safe range.
So if wait, what do you mean like avoid back pain? Some people can have back pain and it can get cured with wearing heels.
I'm not saying you can cure back pain with heels. I wish I was that doctor.
Because I got back pain.
I'm just saying that there's an optimum heel height, and if you stick to it, you can look cute and you can still wear heels.
I was about to say, is my insurance going to cover the Manolos for my back pain?
Oh, I see.
I'm assuming not. But so then heels. What type? Are Manolos worth it? What type of heels are you looking at? Do you recommend?
So the top brands that I've seen with wide toe boxes, right? So if you're wearing a narrow toe box, just kind of squeezing everything into one place.
Like the triangle.
Yeah, the triangle. But if you go a little bit wider, like the Ferragamos, right? You won't have so much nerve discomfort. You won't be squeezing everything in one area. So that's a good one. Valentinos with the ankle straps actually give you ankle stability, believe it or not.
Interesting.
So think about it, 2.5 height, ankle straps. Now you're not kind of flip-flopping around in heels. You'll actually look good at the end of the night and not have pain. Okay,
so we can have heel pain. There's certain heels that can prevent it, certain heels that can, just kind of...
aggravate it.
Yeah. Thank you. I was going to say flabbergasted. I don't know why. Thank you. Aggravate it. What else are you seeing? What else are people coming in for?
So a lot of people come in for the most other common, lots of Americans deal with it, toenail fungus.
Toenail fungus?
So have you ever noticed your toenails are thick or yellow or discolored and there's some debris coming out of it?
I've seen discolored because if you're constantly wearing nail polish or something, that's how it'll get discolored. But fungus, I've never really seen.
Yeah, so fungus can happen on the skin. It's called athlete's foot, or it can happen on the toenails, where it makes the toenail super thick.
Okay.
It is really difficult to get rid of. So I say prevention. The most common place to get toenail fungus, drum roll, the nail salon.
Wow. So what is it like during your pedicure, or is it like post-care? Like when?
So for me, for example, I would say make sure your salon has a tub cover. That right away you're not transferring the same germs from person to person.
Okay.
Sterilizing the equipment. So they're using a lot of instruments that are going underneath your nail. If they don't sterilize it the right way, you're transferring organisms.
Interesting.
Yeah, that's important.
So that itself is just going to get you. So then besides looking at like that, is there anything else you can do to prevent? Is there a type of nail polish that I should be wearing? Is there a type of like moisturizer? Because they'd be putting on anything.
Yeah, good question. Great questions, actually. And I get this a lot from our younger clientele. They actually, they want to prevent this sort of stuff. There are a lot of hydrophilic nail polishes. So these are halal, water-friendly nail polishes sold in a lot of the Arab world, but also in the U.S. now. They allow your nail to still be able to get water underneath between the barrier of the nail and the nail polish. Those prevent too much staining of the nail bed, things like that. So Inglot, Dr. Remedy, these are the nail polishes I really do like if you want to not stain your nail bed. Yeah.
Okay. And anything for moisturizers you see?
Yes, so cracked heels, right? In the winter time, we're in the winter. I know the Bay is not that bad, but here in the US it gets
The Bay is really bad actually. Like the dust can really just
Oh,
crack your
interesting.
heel.
Yeah, so the best time to moisturize is right when you get out of the shower. Your skin is slightly damp, and then the moisturizer can really sink in.
Any type?
No, so let me tell you, I have patients that come in and they're like, "Doctor, I put Vaseline on my heels. I lathered it up, and then I put a sock on. I went to sleep, and I woke up, and I still had cracked heels."
Yeah.
Well, Vaseline doesn't go through. It's not a
Okay.
vehicle that goes through the skin. It's an outer covering, right? You use
Okay.
Vaseline for outer coverings. Believe it or not, it's not a
Like to
moisturizer.
protect, but not to actually cure anything. Heal.
Exactly.
Heal.
It won't heal it. Yeah. So any sort of moisturizer with urea. If you look for the
Okay.
key ingredient, urea, and the higher the percentage, the better the penetration.
Okay.
So in the US, we have ammonium lactate, we have urea 20%, 40%. Those will be great for dry skin.
Okay, so I want to go back quickly to the pedicure part. So then how often, or is there like, because some people get it very often, pedicures, is there also like a recommended time frame for you to prevent it, or like, get it once a month, get once every 6 weeks? What are you seeing?
I think so. It depends. If you want to get it once a month, that's fine as well. It's not about how often you get pedicures. It's just making sure that when you go get them, you're in a clean environment. That's the biggest key I would give you.
Okay, all right. So before we go into a couple questions that came in, because a lot of people actually have so many questions when it comes to just feet maintenance in general. I just wanted to ask one other thing, and this is a personal one. What other shoes am I supposed to be wearing? Like besides heels, I know we covered that, but like, you also mentioned runners and all that. Are there any shoes that you recommend?
So this is a favorite topic of mine because I think comfort is fashion. Time to change the industry.
Oh, hey, time to change the industry.
So if you see now, girls aren't really gravitating towards heels. They're wearing sneakers. That's the trendy look.
I'm seeing a lot of people wearing Crocs.
Well, yes, so we can talk about Crocs. But for a good day-to-day shoe, sneakers is the way to go. And it's not just any sneaker. If you can pick it up and you just can bend it in half, that's a bad sneaker. That's not going to give you any structural support.
Okay.
But if you pick up the shoe and you can't bend it, that means it's a strong sneaker. It will have a lot of shock absorption. So when you walk, it's not going to be giving your feet the shock. It's going to be absorbing it, as the shoes should be doing, right? Some favorite brands of mine are New Balance, Asics, Hoka, Brooks. Those are great sneakers to wear.
Okay.
As far as Crocs are concerned, my daughter does not wear Crocs. I don't own a pair of Crocs. I feel like Crocs
Your mother does.
Well, we're going to have to talk to Ami about this. I'm pretty sure I bought them for her before I started podiatry school. So you know what? I blame myself. But Crocs give you no structural stability. You're just walking on a flat surface with Crocs. They feel good. They're wide, but they give you no support.
But then my thing is, if I'm chilling at home all day, I'm not wearing sneakers all the time, or it doesn't always go. Sometimes like the Crocs has that flip-flop vibe, or just flip-flops in general. The day-to-day you said is a sneaker, but then what else can you do day-to-day?
So at home is different. If you have hardwood floors, you can wear any supportive shoe. Like a Croc is fine for home. I was talking about more running errands or going to the mall where you're going to be walking around a lot and, going in and out of stores. But at home, if you have carpet, you don't need to wear realistically any shoes. But if you don't have carpet, the wood is too much for you. It's too much pressure. You need a barrier. So any sort of supportive slipper would be good.
Okay.
Vionics has good ones. OOFOS, OOFOS, amazing slippers for the house.
Gotcha. Okay, all right. So I want to go into the questions because I think that these are really interesting. So the first one I have is from, I'm not going to reveal, actually, why am I going to even reveal that? People who have smelly feet. They sweat a lot, every time they take off their shoes when they come into someone's house, because as sometimes in Southeast Asian culture, we take off our shoes before entering. Their feet, the odor is there. What are they supposed to be doing? What can they do? What's out there?
So
why is that happening also?
Okay, the medical term for sweaty feet is hyperhidrosis. Why does that matter? That means your sweat glands are just overpowering, okay? Sometimes it's genetics and sometimes it's environment induced. That means, I have construction workers that are just on their feet all day. They're gonna sweat. They're in these boots all day. I have people that aren't construction workers and they sweat.
Yeah.
What are they gonna do? So some baseline things that you can do is there's a spray over the counter called Drysol, Drysol. You can spray your feet with that. If you tend to sweat a lot, you can change socks in the middle of the day, things like that. Historically, this is really cool. They used to do Lipton tea soak, so Lipton bags, like black tea, warm water. The black tea absorbs the sweat.
Okay.
So that's something you can think about. So
you put a dry Lipton tea bag in your shoe?
Oh, no. So it's a tub with warm water. You have Lipton tea bags in there. And then you soak your feet in that. It's a soak.
Okay. So gotcha. That's what they would do.
You immerse your feet into this water, and it decreases the sweat glands overproduction. Things that you would be interested in, my younger population, Botox.
I was going to say, yeah.
So Botox is not FDA approved.
Wait, so Botox like in your feet what do you mean? Like where would you put it?
So you would be getting injections directly in your feet to decrease the sweat.
On the sole?
On the sole of
That's
your
where
feet.
you sweat. Interesting. I was actually thinking right now, like, where actually do you sweat?
Yeah, on the sole, plantar foot. But so a little painful, right? That's why I didn't go straight into Botox. Yeah. I could have said, hey, Botox. Too. No, I eased my way into it because there's other things you can do before you consider this option. Now with Botox, it works about 6 months. You might need another injection again, right? But it does significantly reduce sweat. It works in a matter of weeks. Whereas the other ones have to you have to do it more routinely.
Okay. So another question that we have, great answer, by the way, great answer. I
feel like we're learning a lot today.
We are. And honestly, I feel like people don't get it. Our tone sometimes sounds like really sarcastic, but we're actually not. It was a great answer.
This is definitely, thank you. Thank you.
All right. So there's a new movement of people walking barefoot on Earth. They're just like, they want to connect with Mother Earth. And apparently it's really good for you. Literally, one of my friends told me, you should walk outside in nature for 5 minutes on like the soil, the grass, whatever. I don't know why he said that, but he did. What's your thoughts on that? Is that solving anything?
So connecting to the earth, meditating, I'm all about that. 5 minutes, fine. But this is what I tell people. You can get fungus from your environment. You can get warts from your environment, things like that. Okay. So, for example, when I go to the hotel room, the first thing I do is I make sure I have my slippers. Okay. I have a lot of swimmers, little 6-year-old girls that come in and they're like, I have a wart. And then it's painful to get rid of that wart. So I say 5 minutes, fine. But more than that, realistically, if you're in a public area, public showers, protect your feet.
Okay. What do you mean public showers? Like, how would you protect your feet in public showers?
I carry a pair of rubber slippers with me. I go into the shower and I use them. My feet do not touch a shared surface. But then again, I'm a foot doctor, right? Yeah. Like, I'm going to take it to the next level.
Yeah.
But I'm just saying, for a hotel room as well, you can wear slippers and avoid fungus.
Oh, interesting. All right. So I had a question here. It's really interesting, actually, where I think the question was actually, what are foot exercises for working out? But then I think it comes with, is it losing fat that you want in the feet? Is there something that like, I feel like we talked about it yesterday, but now my notes aren't reflecting the question right.
So you want to lose fat anywhere on your body except for the bottom of your feet.
Except the bottom. Like, is that the heel?
No, it's the metatarsals area, the knuckles.
Oh, interesting.
So think about where your knuckles are.
So we do not want to lose fat in our knuckles.
No, because if you do, you start forming calluses. Your bones are touching the skin, the ground more often. Okay. There's friction going on, friction blisters, calluses, corns. So there's actually fat injections that people are getting in their feet. It's mostly older women that have lost fat pad, and now they're like, oh, my bones hurt so much every time I walk. They form these calluses. You can't do surgery on them because they're just higher risk patients. So getting them some fat injections help to build up that fat. It's a cushion. It's a protective cushion. You don't want to lose it. So remember, I told you, wear slippers in your lifetime. Protect your feet. Because even in your old age, you want that fat there. So if you're running around and you're decreasing the fat pad constantly, you're going to, come to terms with those problems.
Okay. How do you prevent ingrown toenails?
Great question.
And how do you get them?
Well, okay, so some people, once again, genetics can play a role. Ingrown toenails or toenails that are just growing really deep, and then they can cause an infection. You can get some pus, and they're really painful. So if you wear really tight shoes, you can get ingrown toenails. If you dig deep into your nails, you know, like moms, they're like, let's cut the nail really, really short, as close to the skin as possible, so we don't have to cut it again until another week, you know?
Yeah.
You can get an ingrown toenail that way because you're irritating the skin surface. So I tell lots of moms or anybody that wants to cut their toenails, cut them straight like a square. Don't think about getting so close to the skin surface. Wear wider shoes. Some ways to treat ingrown toenails at home, if you can't get to a podiatrist or if there's nobody that can help you take it out, Epsom salt soak. So if you soak your feet,
Like the Dr. Teal's ones, yeah.
Yeah, you could do those. Yeah, Epsom salt soaks. Epsom salts are actually anti-inflammatory, so they
Okay.
decrease pain, decrease inflammation. You can use some Neosporin, just topical antibiotic, put it on the ingrown toenail,
Yeah.
wrap a Band-Aid. You can prevent it that way, but it's quite painful. So I hope you can find somebody that can remove it because it's amazing. But to prevent it, I would say cut them straight, wear wider shoes.
Okay, so you said inflammation. So a lot of people, I don't know if inflamed is the right word, when they're traveling on airplane rides, are their feet inflamed? Like what happens? Because even I feel that after like...
Yeah. So that's called edema. That means swelling, right?
Okay,
It's
swelling.
similar, but so yeah, imagine going on an airplane ride or a long car ride for 3
What's
hours
long?
plus.
Okay, 3 hours.
3 hours plus, and you're constantly sitting down. Your feet
Okay.
are hanging down. Gravity's pulling all this fluid down, and it can't push it back up because your valves aren't working the right way. So I tell people wear compression socks. Walk around the airplane because when you walk, you cause the body to let the fluid kind of flow. Compression comes in many strengths. The lowest strength is like 5. That's good enough. Anything is better than nothing. So
Yeah.
I would say wear compression socks.
Okay.
Yeah.
So I feel like we learned a lot. I feel like we learned about the types of heels, how to prevent like toenail fungus, how to even get that. And then we covered like even if we need fat in our feet. So I feel like I learned a lot. So thank you on that. But I want to cover now some of your personal life, besides being my sister and beyond. You are a mother.
Yes.
And
to a
you-
very cute 3-year-old.
To a cute 3-year-old, 2.5. 2.5.
That's true.
Let's be honest here. Nua's still young. Okay. How is it being a mother and being a doctor and being like a brown woman, a woman of color, living, living in this century?
You know, it takes a village to do everything. I feel like I outsource a lot of stuff. I have an amazing nanny who's been with my daughter since she was 3 months old, and now she's 2.5. So I'm lucky to have found her. I am not the best cook, but I like healthy organic meals. So I found a Pakistani female that makes us food. I believe outsourcing to smaller Muslim female businesses. Hey, support each other. It's all about supporting one another. I'm busy taking care of patients, but my family life is important too. I'm just making sure that I can outsource those things so I can use my attention to help with my patients. But obviously my daughter, my family knows I'm there for them.
Yeah.
Females can do it all. I think we can do it all. You heard it.
You heard it here, not even first, but you heard it here again. Females can do it first. But I love the way that, I feel like honestly, and we've always made fun of this, but I also admire you. You always have this glisten in your eye whenever you're talking about your patients and how you take care of them. So I feel like we talked about a lot of like the glamorization of podiatry, like wear Manolos, get your pedicures. Is that what you're doing? And even if you are, no judgment to that. But what are you doing?
So my passion actually lies in saving limbs. A lot of diabetic patients end up getting amputations.
Oh, damn.
Amputations shave off years off of your life. So
Okay.
if say you get a below knee amputation, 5 years are cut off of your life automatically. That significantly impacts their mental stability, their family life, everything.
Yeah.
So my passion actually lies in saving limbs. I have patients that come for second, third opinions where they're like, "Hey doc, I was told nobody can save my foot. Could you do it?" And I'm like, "Look, I'm no expert. I am now, obviously a wound care expert, but we work day and night, and I can say, comfortably, it's the most rewarding thing I've ever done. I have saved a lot of feet, and with that, I've saved their life and a lot, their family life, everything, and it means the world to me. I love fashion, as you can tell. I love decorating my house. I love taking care of my daughter, but I love saving limbs. It's called limb salvage. I love it.
Limb salvage. So then what's next? Like, are you going to continue saving limbs, saving lives? Are you gonna just branch out into anything else? Have you thought about what's next, or are you just like having a good time?
I think, medical missions is something I'm always interested in. I think I have to give back to Pakistan. So I'm looking out, and I've reached out to a few projects back home. As you know, whenever we go back, there's always something lined up there. For now, locally helping my community, volunteering at a free clinic, whatnot. But yeah, so you can follow me on Doctor's Traveling Shoes. I love to travel as well. Can you believe it? I don't have much time, but when I do, or pre-COVID, it was easier. And then setting up my Amazon storefront, so it's easy for people to use or get whatever is most comfortable or podiatrist friendly, recommended.
Yeah. And what do you see mainly like in Pakistan, or like people that are watching this show? It's going to be honestly a bunch of my friends. They want to, and they always come to you with like, our moms are doing this or our dads are doing that. What can they notice maybe in advance, or like, what can they just kind of gift them to? Like, this will just make their life easier in terms of like foot care.
Good shoes, compression socks, some stretching exercises, a lot of stuff like that. But most important thing is knowledge, right? Talk to them about their feet, take them to a doctor.
Do foot massages
let them
work?
Be heard. Excuse me?
Do foot massages work?
Well, if you're Kid and Fatima, yeah, they do. But everything's a little bit more than a foot massage.
Okay. I mean, no, I was just asking, like, what if they're like the son or daughter come home, give your mom a foot massage?
It's a good way to connect.
Okay, that doesn't work. You heard it here first. Foot massages don't work. Okay. But thank you so much. Thank you so much for coming on the show, Aman. Dr. Aman Fatima. How can the masses be connected with you?
So as I mentioned, you can follow me on Doctor's Traveling Shoes. You can follow me on my Amazon storefront. And, just spread the word out there. Your feet are important. You need them for the rest of your life. So take care of them.
All right. Thank you.
You're welcome.